This is a Lowell City Council Substance Abuse Subcommittee holding a public hearing. Today's date is Tuesday, December 15th, 2015. Roll call, please, Mr. Clerk.
Chairman Belanger.
Here.
Council Mercia.
Here.
Council Rook. Here. 3 present.
Thank you, Mr. Clerk. On the agenda this evening is the City Council's request the city manager work with the school superintendent to mandate opiate addiction education into the Lowell school curriculum. I can see we have a well-attended meeting here tonight. Thank you, everybody, for attending. So to begin discussion, this was passed unanimously in the City Council that we all know how the City of Lowell is to be hit very, very hard with this opiate epidemic here in the city. And I think we all feel it's very important that we do all we can to take preventative measures in the schools where it's in the education into the curriculum. We all know that city, we're doing all we can. The educators here in the city are doing a fantastic job. There's often guest speakers, and there's the movie If Only, which is played pretty frequently. That had about 300-400 at the Lowell Auditorium just a few weeks ago. That's great and all, but I think we're all in agreement that it's simply not enough. But it does hold challenges. It's not just something we can start right away. There are challenges ahead, and with that being said, I'd like to start maybe with Headmaster Martin. Mr. Martin, thank you for joining us here this evening. We've had a meeting last week with the city, the task force, through the mayor's opiate epidemic task force, and you had made some great points, Headmaster Martin, on that. This can be achieved, but there's challenges. So I wonder if you could elaborate, educate the subcommittee and the folks at home.
Thank you, Mr. Chairman, and thank you, subcommittee members and Mr. Manager and other advisory committee members. We're really interested in being part of the task force. I don't really know where the superintendent is this evening. I'm assuming someone will be coming, but in any event, one of the discussion points we've had at the high school in respect to curriculum is how do we collaborate between the high school and the rest of the school system, understanding that this isn't just a 9 through 12 issue. We believe it's a middle school issue as well, as far as awareness and education. But secondarily, how do we collaborate with the other professionals in the field and curriculum professionals who could find ways to incorporate training, programming, and specific curriculum into classrooms. For example, at the high school, we do cover all of the opiate and alcohol issues in health classes. It's a standard course for all of the freshmen that come to the high school. They take 2 semesters of health and do cover this in Mr. Morneau's science programs in health. But we feel that we are really just scratching the surface in respect to understanding really what should be covered, what are the necessary training aspects that professionals in the health field could provide to our staff. And what's interesting is we discuss these issues all the time. For example, we discuss financial literacy that kids really need to understand. Well, how do we train all of the staff in financial literacy? How do we train all of the staff, for example, in cultural competency? Well, there are other professionals that we would bring in that would help with our staff to focus on what we really should be covering, for example, from grades 4, 5 through high school and beyond. So we are very open to working with the manager and all of the members of the task force. We've had Katie Sheridan has been involved, the outreaching in a number of issues for the school as well. But we're ready and willing to play any role in support of Councilor Belanger's subcommittee.
Thank you, Headmaster Martin. No, you're right. I know it's in there to a point, Mr. Headmaster. I do understand that, and I know there are challenges along the way, specifically with training. And I don't see Kerry Detremont here this evening from Greater Lowell Health Alliance, where she, after our meeting with the mayor last week, she has sought out some grants, that there's grants available that could be put in the school system for training to ultimately mandate this into the curriculum. So it's going to be a process, Mr. Headmaster. And appreciate your cooperation, knowing that full well that this is an issue, and this could preventively cause us from losing another generation by mandating in the curriculum. I appreciate your efforts. But Mr. Manager, to you, has there been any correspondence with the superintendent on this matter?
The interesting thing is, in the last budget, this council made a great choice by designating a Department of Health and Human Services to replace the public health director, because we understood that public health needed more than just somebody looking over the statutes in that particular department. We needed somebody to collaborate with different departments in the city and have public health collaborate with the school department. And Joanne Keegan has been serving as the interim director of Health and Human Services. I know that she and Assistant Superintendent Janine Durkin have been working closely together relative to collaboration between the Municipal Department of Public Health and the school department. And I'd just like, if you could address for the City Council some of the ways that we're trying to help out the school system and how we'll continue to try and help out the school system in the future.
Thank you. To the subcommittee and the city manager, one of the first things that Ms. Durkin and the health department staff did was sit down and talk about, where we should start in terms of curriculum in the school department. And we have started a pilot program starting in January among fourth graders using the Healthy Futures curriculum as a pilot, incorporating substance abuse into sort of a healthy choices curriculum. And that's just a pilot program because until we go, have a system-wide discussion, a whole discussion about the entire school system and have some funding and have an opportunity to train the staff at the school department, then, we have to have that discussion, but we haven't gone system-wide yet. We wanted to try this pilot program among fourth graders. The health department has also been reviewing evidence-based curriculum, a variety of different options for what would be a good choice for a curriculum. We have access to it through the Department of Public Health, and we have one that we think is the best one available. It's called Life Skills, but that would be down the road for a discussion with the school department. Some of the challenges, I think, as Mr. Martin pointed out, is getting this into a very busy student day, squeezing it into the hours that are already filled, taking other time away from other things. And I think everyone is committed to that. But those are just the preliminary discussions that we've had with the school department and the pilot program that is starting in 3 schools in the 4th grade in the city of Lowell.
That's very good, Ms. Keegan. Thank you very much. That's a great start. Mr. Manager?
Yeah, I know it's a collaboration that we need to continue. I know Assistant Superintendent Janine Durkin has been really active in recognizing the issue and making sure that we begin early, as you said. I don't know if you wanted to do it, but I thought it might be good for Trinity Ambulance gave us some evidence. Did you want to do that now, Mr. Chairman, or did you want to wait on that?
Yeah, okay, that'd be a good idea.
I don't know, but Trinity Ambulance has provided documentation and statistics relative to the comparison of opiate abuse overdoses in the month of October as compared to November. And I think, although it's good news, it's still news that we have to continue to make sure that we work on this project, especially in the school system, like this subcommittee is charged with doing.
Oh, thank you, Mr. Manager. To Mr. Kelly from Trinity Ambulance, thank you very much for joining us this evening.
Thank you very much. We saw an increase in October in the severity and the count, and then we've had a nice decline for November. It's still obviously nowhere near any of us would like, but it did go down to the lowest we had seen. If you go to the categorized report for, that's October, I'm sorry, hold on one second. That's back.
Lowest since June.
Lowest since June for the categorized opiates. We did see a decrease in the priority 1, which are the truly life-threatening believe the month before, we were at 31, and we were down to 19 for November. I don't know if that's just a 1 month off, or is it a trend down? It's way too early to be able to say that either way.
Okay, Mr. Kelly, to you. Now, the first page of the report is overdoses. That's everything, that's all combined, right? Opioid and everything, right?
Everything but alcohol, yes.
Everything but alcohol,
Yes,
yeah.
sir.
That's I think, the figure that we should use as the guideline. It's the highest, unfortunately, but that's, I think, the most accurate. And then again, they're not confirmed to this point yet, right?
Correct.
Okay, all right. But I think it's still, I mean, larger chance than not that it is opioid or heroin related for the most part between,
No, I don't. I think it's almost 2 to 1, right? It's about 50% of the overdoses from that report end up being opiates.
okay. Okay, but nonetheless,
So 51 out of 96.
yes, okay. But, pretty staggering where the month of October was the highest average we've seen yet, nearing almost 5 per day, 4.6. What a staggering number. I know it's keeping you busy and our law enforcement officials and fire officials. But to the good news, I guess, is November did trickle down a little bit to just a little over 3. Hopefully, that's the trend that continues to trend in that direction. But nonetheless, there was much to be done on this issue. It's just continues to get worse. I mean, November was a sign of maybe a ray of hope, if you will. But I think at this point, anybody, subcommittee members, anything? Council Mercia?
Well, I'm glad that we're finally starting to, instead of talking, to try to initiate something into the school system, and the 4th grade is a good start. I know that once you're in the high school, it's a little bit too late, so you have to start very early, and 4th grade kind of cuts it. I would even recommend going earlier, younger grades, but it's just mind-boggling when you see what's going on, and it was tough. I'm redirecting this to the headmaster because I was in a school just a month ago, and I was talking about voting and stuff because the kids wanted to know during the primary why the school was so busy with people, and the teacher thought it would be a good idea for me to come in and explain what voting was all about, and I did because they were learning a little bit about that. And then I got to talking about other things, and then, they say what they feel, and the little girl, we were talking about, grandmothers and this and that, and the little girl raised her hand and said, I have a grandfather, and he sells drugs. So, I mean, it was rather shocking for me to hear that. So was it shocking for the teachers, but, I just don't know if you're coming from a household that's a common thing, it's really mind-boggling. I don't know how you can get to the children to tell them that this isn't right when they're doing it at home. This is a society that's a little bit different than when we grew up. But I just wanted you to know, Mr. Martin, that you have a good woman on the left side of you who did a tremendous job speaking at a city council meeting, and everything she said was right on target. And we've talked a lot about it. We've planned this and that. I know our district attorney, Marion Ryan, is right on top of it, the issues and the task force and this and that. But I'd like to see some involvement, some starting points where we are into the school, trying to make headway with the children so that when they get up into high school, they're not going to parties experimenting and looking in somebody's medicine cabinet and doing things like that. So we got to tell them, we've got to show them. I like to get someone in the school system that has been there and back. We did have an excellent meeting that our chairperson and I went to the methadone clinic, Habit Opco on Stedman Street, and it's just tremendous what they're doing. I know that I was one of the first that would that when they were leaving Suffolk Street to say, please, please let's have that in our city. It's like, gee, we don't want to be associated with people like that. Don't have it here. That's like saying, gee, there's sick people in this city. We don't want Lowell General coming here. These are sick people that somehow we want to make them better. We don't think that they belong in jail. They need a detoxification. But we did see the clinic, the methadone clinic. It's just a tremendous asset to the city. It's a help. That's why I do everything I can to help this great cause with these people trying to put their life into perspective here. I know that when we went there, we took a tour of the place. We learned that there's 900 people that are involved in this program. They do this program 7 days a week where they give the methadone. They even offer Suboxone, but a lot of insurance companies don't pay for that. It's a very, very crucial that these people are taking this drink and it's making them stabilized. That you could be in a restaurant and see people aside of you or at a meeting or even in this room that are on it and you wouldn't even know because their life has meaning now. I know that I work for the sheriff, and this particular day, one of the clients came in. He was a level 2, not a level 3, but a level 2 client. And he said to me, oh, I'm so grateful for the Suboxone. So I said, oh, you are? You're grateful for it? Tell me about this. He said, I was in the service for 4 years, and I came out of the service, and I lived in Lowell with my family, but I moved to Florida, and I was in Florida, and I was in the safety of my own bed, and I woke up because this guy was standing over me, ready to rob me, looking for my wallet, and I grabbed his arm like this, and I didn't realize that there was a guy behind him with a knife, and he slit me all the way up here to the point where I just lost it. I didn't know if I was going to die, and there was another one behind me, and he took a bat and hit me over the head. He was all messed up from that point. So when we look at people and we say, oh, they're a loser, they're on drugs, we don't know the history of what they've been through. So this is why I have a burning desire to do what we can to help people. I don't look upon them like some people do. I know there's people that want help, there's people that don't, but we should be available to help those that are wanting to get help because they can lead productive lives and get back into society. Just like an alcoholic. They're always an alcoholic, but they're always functioning properly. So there's people that have an imbalance, a mental imbalance. The minute they're off their medication, they go haywire, but when they're on it, they're fine. Therefore, by the grace of God go I don't have that problem yet. Knock on wood, thank God. It could happen to anybody. It could happen to our loved ones. These are somebody's loved ones. That's why this is a very important issue here in the city, and we're doing all that we can to help. I'm grateful to each and every one of you for putting your minds together to make this a better city, and we're working on it. I'm just glad that we're finally trying to get someone in the school system to start with the children, because they're thinking something else back home is happening, that's normal, and it isn't normal. They should know that. That's all I have to say, sorry.
Very, very nice, Councilor Mercia, thank you. And I think you're referring to stigma, and I think that's changing, Councilor. I think more and more people are realizing this is a sickness every day. I think that's changing.
If I could just add one more thing. I said, why don't people, brag about this place? I think it's a wonderful place. Why don't we get some people here that say, I was down and out, and this place helped me? And you won't get it because the people are embarrassed. They are embarrassed as to what they've been through and what they put people through. So they're not going to promote it, but they're just grateful that they're getting better, but they don't want to advertise it to say that only a rare person would probably do that. Probably I would say I was down and out. I was on a drug of a cigarette. I was a very avid smoker. That's a drug. And I believed that my son was smoking, I mean, not smoking, he was drinking very, very bad to the point where he wasn't a good person. And I said, if you stop your smoking, I'll stop my drink. If you stop your drinking, I'll stop my smoking. And we shook hands on it, and October 25th was 11 years. He hasn't had a drink, and I haven't had a cigarette. So, I mean, it's just a rare thing, but it's not easy to do. But so I could say that it happened to me, so that's all I wanted to say. Sorry.
Thank you, Councilor. I'll go Headmaster Martin, then I'll go to Terry Downs from Middlesex Community College.
Okay, yes, thank you very much. What I was going to suggest is that we, as the school, for the high school, agree to come back here in, say, 30 days with a draft of what we could consider as a beginning proposal for what the public schools could work with, so that we could reconnect with the superintendent and Mrs. Durkin and Ms. Abrams and be prepared to present what we think may be the beginning of a discussion on how this would all work. And that way we can reach out to everyone here, perhaps have our own session to talk about what's available, what training would be needed, what timelines would be appropriate to initiate something in the short term, and then in the long term have additional proposals, so that you could say, for example, in the fall of next year, we would have these proposals incorporated into specific programs at the schools. Again, that would give us a chance to debate, look at the merits of it, look at what the funding might be for training, what other options are out there, so that we can come back to the group and present, if that makes sense.
That makes a lot of sense, Mr. Headmaster.
Okay.
That's a great plan. Thank you very much. Terry, Mr. Downs, Middlesex Community College, thank you for joining us, Terry. Thank you.
Well, Mr. Chairman, thanks for the chance to be here, and Mr. Manager, thank you for the opportunity to come in and participate. Just a couple of things quickly. At last week's meeting of District Attorney Ryan's opioid committee, or her working group, I'm sorry, they handed out the statistics for November and for the year through December 4th, I should say. In 2013, now this is county-wide, there were 80 overdose deaths, 1/3 of which were related to heroin. Last year, it went to 145 countywide, 2/3 from heroin. So from 1/3 to 2/3 heroin. So far this year, as of December 4th, there have been 173, and again, 2/3 due to heroin, and that's countywide. But the urban areas, Lowell, Cambridge, Somerville, they continue to suffer the worst of the epidemic. At Middlesex, so far this year, there have been 2 forums for students and faculty. Now, as you know, at the college level, it's a little bit different than at the high school level. The students, the faculty members, are not required to go to forums like that at the college level. Nevertheless, over 120 students and faculty members attended the 2 forums, each of which had as its principal speaker a parent who had lost a child. As it happened, in both cases, they were college-age children. Both were daughters. Both were in colleges whose names we would all recognize right away here. And they both lost their daughters. So it was really powerful for our students to hear from a mother and from a from a father, each of whom had lost a daughter who was a college student. And in both cases, it was to heroin. So it was good for our students to hear that, good for them to understand the nature of the problem, how easy it is to get into it, how easy it is to die from it, and how important it is to get help right away if you start to have this problem. So we're well aware of the problem. We're very sympathetic to the people who are suffering from it. As Councilor Mercier points out, it's a disease. It really is a disease. As many people have said, nobody got up in the morning and decided, I think I'll go be a heroin addict today. It's a terrible disease. We're going to be working in partnership with the city to do whatever we can at the college to help get the word out. And certainly if we can be of help to the college, to the city in any way the college wants to do that. Thank you, Mr. Chairman.
Thank you, Terry. Thank you for joining us tonight. That's great information. I know Middlesex has been very active here in the forefront. John, to you. Oh. Chief Winwood.
Thank you, Chairman. I'd also like to comment that the fire department is continuing to use Narcan at some of our serious overdose calls. We've been doing it for a little over a year now, and it's made a big impact. It's made a positive effect. Lowell Police have also started carrying Narcan, as well as Trinity Ambulance, and even some of the victims and their families are carrying Narcan. And the Narcan, along with oxygen and rescue breathing equipment, is making a big difference at some of these overdoses. And we're continuing to pursue federal grant money along with our public safety grant writers to make sure that we have an adequate supply of Narcan on the trucks. And Chief Taylor and I are also working on a program where we're going to try to put a pilot together where we'll group a firefighter, a police officer, and maybe a public health person and go out to some of these overdose calls and try to screen the person and get them into some kind of a program or get them some kind of a help. And we'll be working on that in the near future. And another approach we're taking is our public safety firefighters are going out into the schools and they're teaching the kids about fire safety. And we're working on a program to start teaching them about the effects of these terrible drugs. So we're kind of trying to attack the problem from a multi-pronged approach.
Yes, you have, Chief. You do an outstanding job. You really have. I see the Lowell Fire Department's been very active with, you applied Narcan 10 times in the last 2 months. That's second only to Trinity EMS, so you're certainly doing your job as a first responder. You and your department's doing a fantastic job. Please
Thank
keep
you,
up the
Counselor.
good work, and we look forward to you and the chief working together on that pilot program, maybe up to the first of the year. We'll hear that out along with Headmaster Martin's program as well. So, Chief, thank you very much. Keep up the good work.
Thank you, Counselor.
Councilor Rook?
Yep. Thank you, Chairman. We do have here tonight School Committee-elect Bob Gignac, Mr. Chairman, who I believe his first term as a member of the Lowell School Committee did file some motions concerning what your motion is on for tonight. So if you just ask him to come up and give a little history of what his motion was and what the school system is doing now concerning it.
That would be great, Council. Thank you. School Committee Member-elect Bobby Gignac, welcome back.
Thank you. Thank you, Mr.
Please
Chairman.
inform the subcommittee and the folks at home.
Sure. Well, thank you, and thank you for bringing up this most important topic. First off, I'd like to apologize that there's no one here from the central office. I've been in touch with the superintendent, and he unfortunately couldn't make it. But just to touch upon a few things that we started about 4 years ago, I actually worked with former Assistant Superintendent Ann Murphy, the good Murphy, and State Representative
cover
Tom
yourself.
Golden to really form a group to attack this issue, and this was 4 years ago. We brought in the chair of the health department, Joanne Keegan, then police chief Ken LaValle, and then interim superintendent Friedel, as well as members from Trinity and other agencies. And what we did is we developed a program where we had the health department health educators go into the elementary schools and talk to the youngsters about the dangers of drugs and the importance of making the right decisions and not going into your parents' medicine cabinet and not, experimenting with very dangerous things. At the middle schools, we had the school resource officers as well as additional police officers go into the schools and talk about the dangers of drugs. And then at the high school level, we had I raised some money and got a speaker to come in, a former professional baseball speaker who was about my age. We had him come in and speak to every single student in the high school. And they were able to ask him questions, and the questions were really unbelievable. In an auditorium filled with students, live broadcasts across the entire school, we had kids ask, "What do you do if you come home and your dad's overdosing?" In front of all their peers. And this was very successful. These programs were very, very successful, and we kicked off the first ever Opiate Abuse Prevention Awareness Month 4 years ago in October. The very next October, we did the same thing. We did similar programs. We had youth-led forums at a number of schools where there was a panel of young men and women that just talked about the issue of opiate abuse. And that was really very powerful. I can't say what's been done over the past 2 years. I know the health department, police department, all these partners that are here have continued to work on it. But I can assure you the school department will be a partner in these efforts. And I thank Headmaster Martin and his staff for being here, because it's not just the high school. We have to go very young, but the headmaster is really committed to doing this. And I can assure you that I will bring this message forward to the school committee.
Thank you very much, Mr. Gignac.
Thank you.
Well done. Congratulations on your election. I know your first term in the school committee, you were very, very active on this issue, and you were sadly missed. And
Thank you.
we know you're going to continue that in January.
Thank you very
Thank you
much.
very much for your hard work.
Sure.
With that being said, I'll open it up to the public. Well, okay, I'm sorry.
That's okay. So we at Trinity are bringing a program. It's called an illness and injury surveillance program. So we purchased it. It should be online by February 1st. So what this program will do, we'll give access to it to the city manager, and he'll decide who within the city can access it. And basically, it's going to show live opiate locations. So right now, you guys have to wait till the end of the month to get the data from us to see where everything is.
Yes.
So with this, there'll be basically a Google map, and every time when we go to an opiate overdose, and the chiefs or the health department can decide what range is important to them, whether it's the last 6 hours, the last 3 days, the last week, and there'll be a pin on a map as to where that opiate happened. So law enforcement, maybe they pick up patrols in that area, the health department, maybe they do outreach. We're not exactly sure how to deploy it. We're getting in early. We're going to be the 8th service in the United States to bring this online. It was developed from Richmond Ambulance and the DEA down in Richmond, Virginia. We just got it installed a week ago, and so we should have it out and in the hands of the users by the beginning of February.
Wow, that would literally be up to the minute data that will be online for city officials or whatnot. That's outstanding. I mean, your reports are so comprehensive, and it's just from demographic, from time of day to age group, what part of the city, what time of day. It's unbelievable. We appreciate it.
We'll keep doing these as well, but
Yeah,
we wanted
right.
to cut again, one more thing we thought we could bring to the table to help everyone.
It's going to be very helpful. Thank you, and thank you to your principal, John Chumley, at Trinity Ambulance. That being said, anybody from the public would like to chime in on this issue? More than welcome. Take the podium. Okay. No. Okay. That being said, Terry Downs.
Yeah, just one quick thing, Mr. Chairman. There's been discussion at the meetings about how good Narcan is and how important it is, and it is a miracle drug. There's no question about it. The one thing that's overlooked, though, a lot of times, is that it only buys you a short period of time. It doesn't just wipe out the effects of the overdose. It blocks it temporarily, so the person starts to breathe again, and so they don't die out on the street. But it only buys you something like 30 minutes, 60 minutes, something like that, and it's really important that the patient be brought right away to an emergency room so the doctors can help them get over the overdose altogether. If they don't do that, they risk the overdose coming back after the Narcan wears off, and they can still die.
Understood, Mr. Downs. Thank you for confirming that. But we know Narcan is certainly not the cure-all to this crisis for sure, but it's helpful. It's saving lives, and first responders are doing a tremendous job in the city in saving lives too, I might add.
Do you want to speak, sir?
Sir, would you please? Sir, you have to come up to the podium.
Come up to the podium so we can hear you.
Please state your name and address, and then you can make comments, sir.
I'm Zach Perry. I'm actually from Andover, but I came to just sort of see this.
Welcome to Lowell.
Another thing along those lines, Suboxone has been also proven to be abused by teenagers and other drug users, that it can have effects similar to opiates, and it can you can overdose on Suboxone, so it is also a dangerous drug that can be abused, but it also is life-saving and a very helpful drug. But there have been reports of abuse of Suboxone. So.
Well, thank you. Thank you for coming from Andover. Appreciate your input on this issue. We'll take note of that. Yeah, please. Good evening. State your name and address for the record, please.
Yeah, I'm Dr. Mindy Doppler Nelson. I'm a downtown Lowell resident. I conducted a study in 2013 at the university that had a sample size of over 1,700 students anonymously, asking them about a variety of things. 28.45% of the students had used an illicit drug within the past year. And just to give you a sense of how that compares to the national data, nationally, 22.6% of 18 to 20-year-olds had reported using illicit drugs in the year. So that just shows that we're higher than the national average. Thank you.
Well, thank you for pointing that out, Doctor, and that's what we're all working on, diligently trying to change. But thank you for that input. Anybody else on the outside like to chime in? Katie Sheridan. You got a microphone? You got?
Put it on?
Is the green light on?
Green
Yep.
light.
Yeah.
There's a lot of money slated to be spent on this issue. Do we know, I mean, we're obviously one of the highest populations of overdoses, the cities of Lynn and Lowell. Do we know if how we're gonna get that money? Is there somebody going after that money right now?
Yes, Kate, that's an excellent question. It's mainly channeled through the hospitals here in the city. Lowell General and Saints Medical will be working through the Greater Lowell Health Alliance. Kerry Detrimont, who was unable to be here this evening, but a lot of that money is channeled through her to the outlets such as us and what we're working on. So she has many programs. Unfortunately, she couldn't make it tonight, but I'll see that she passes it on to all that are here tonight and the task force members. So
Because there's a lot of money slated for,
Yes.
beds and so forth, but education is number 2 on his list. So
Yep.
how is education gonna fit through the health department?
correct. No, I understand,
So-
but there's money out there and we're going after it, Katie. I believe you me. Chief.
Thank you, Counselor. We're also applying for a $100,000 grant, $50,000 for police and $50,000 for fire, for not only Narcan, but also other rescue equipment. Some of these overdose victims need oxygen, they need rescue breathing, they need defibrillators. So we're going to be also applying for federal grant money to replace some of our equipment on our trucks for that as well.
Excellent. More upgrades. Thank you, Chief.
So
Joanne.
we're, watching closely. The Department of Public Health Bureau of Substance Abuse will be supposedly coming down with some more funds that may be able to be used towards the whole curriculum development. So we've been in close touch with them, and they are saying that there will be more funding from BSAS, the Bureau of Substance Abuse, at DPH, hopefully.
Thank you, Joanne.
And just one other thing in relation to Councilor Mercy's discussion about stigma. The DPH again has, this new campaign, hashtag State Without Stigma, and there's some really great things coming out of this campaign, and in terms of public service announcements and things on social media, and I think that will be helpful. I hope.
No, I agree, Joanne. That will be helpful, and I think the stigma is changing. I honestly do. It's still there, but I think it's changing. To your point, Councilor Samaras, anything? No, anything from my colleagues or anybody else in the public have anything to add to this? Anybody else would like to speak? Well, with that being said, I did start off a few minutes late. I would like to thank all the attendees, starting with Katie Sheridan from Lowell High School, Headmaster Brian Martin, thank you. Chief Jeff Winwood, Chief, thank you for all your hard work on this issue. City Manager Murphy, from the Health Department, Joanne Keegan, thank you. Trinity Ambulance, John Kelly, thank you for all your hard work and your up to the date statistics. Terry Downs, Middlesex Community College, thank you. And my dear friends from the Megan House are in the rear, Mary Beth and Nancy McGovern from the Megan House, working very hard over there, doing some great things. Bobby Gignac, School Committee Elect, thank you for your input and your hard work on this issue. Nancy Judge from the Highlands Organization, and her daughter Kim Judge, thank you for attending. Doctor from the UMass Lowell, thank Dr. Mindy, I appreciate you being here. So with that being said, thank you, and I think in closing, we got a few good things to look forward to after the first of the year. That would be pilot programs from Chief Jeff Winwood and Chief Taylor regarding pilot program for follow-up, if you will, I think is the focus. Pilot program from Headmaster Martin, how this could be incorporated. I will reach out to Kerry Debremont and the Greater Lowell Health Alliance, give her the minutes of this meeting, and get some funding updates for the next meeting, hopefully at the end of January or whatnot. So I think we're going to be starting the new year on the right foot. And a year from now, I think you're going to see a significant change in these numbers through all of you, your dedication, your hard work on this issue. And that goes to my colleagues as well, Councilors Mercia, Council Rourke. I don't believe anybody has anything to add, so
To adjourn.
motion adjourned, meeting adjourned. Thank you.
Thank you.